ALS is in itself a rare disease, so association with other rare diseases are possible. Here we describe 5 patients that suffer concurrently from ALS and other rare diseases. In the first case, we have a young man who was diagnosed of ALS after the occurrence of upper limb hyposthenia, who showed during a routinary electrocardiogram a Brugada pattern that was further confirmed after drug stimulation test and cardiac MRI. Genetic tests for Brugada are still ongoing, while genetic tests for motor neuron diseases resulted negative. In the second case, we have a woman who came to our attention for a history of cramps and fasciculation started 2 years prior. She reported a history of similar cramps and fasciculation in her father and in her aunt on the paternal line, with no motor impairment. At the time of our first evaluation, she just presented severe fasciculation and cramps with no motor impairment and an electromyogram with a myopathic pattern. Genetic tests for channelopathy revealed a pathogenic mutation in Cas1 gene. After a few months, she developed a foot drop, and she presented clinical signs of upper and lower motor impairment as well. The electromyogram changed as well, showing neurogenic pattern with acute denervation consistent with ALS. Genetic tests for ALS-related gene resulted negative. In the third case, a 70 years old patient affected from symptomatic pseudoxanthoma elasticum since the childhood came to our attention for dysarthria with a clinical and neurophysiological picture consistent with ALS. His sister, who was a healthy carrier for PXE, died 2 years prior for an aggressive form of ALS. On the contrary, our patient has presented a very slow disease progression so far. Genetic tests for ALS-related gene resulted negative. In the fourth case, a patient with ALS due to a mutation in C9orf72 gene had also suffered from Moscovitz syndrome since the age of 30 in good disease control. And the last case, a man with a history of myasthenia gravis since 2013 developed after 7 years an ALS. In conclusion, for those patients suffering from muscular and neuromuscular junction disease, a link with the ALS is theoretically possible. In other cases, the causal association between two rare diseases is more mysterious, but since the precise pathogenic mechanism of ALS are still unclear, these cases may contribute in shedding light in understanding ALS and its pathogenesis.